Did I say that Chris knows what he's talking about? You know he does. I'll tell you what, get a hold of his book. You'll find it on the website, like I said. And let me tell you, you will find some answers that you need. You know, I was reading right here in Psalms 46 about God is our protection and our strength. He will always help in times of trouble. You know, that's so very true. God is our protection. And God sometimes gives us wisdom to protect ourselves. Sometimes he puts people in our path to show us how to protect ourselves. And that is George Anderson. George is going to be talking about identity theft and how you can protect yourself. Here's George right now.
Hi, I'm George Anderson. Last week we talked about identity theft being up 22% last year. We also talked about how you need to monitor your credit report, your credit transactions, and your bank accounts. And we also talked about reducing the use of checks. Today I want to talk about some other ways that you can protect your financial identity with your credit cards and your debit cards. First of all, you want to use your debit cards as a credit card transaction instead of a debit card transaction with a PIN. If an identity thief gets a hold of your PIN, they can wipe out your bank account. The other thing that you want to do when you're using your debit card in an ATM is use an ATM in a reputable establishment, either a bank or a credit union, not something off the beaten path where they may be collecting your information and going to use it for identity theft. Remember, you don't want to use your bank card as a debit card. You want to use it as a credit card. Go ahead and sign for those transactions. Reduces the chances of your PIN number getting out there. You want to use your credit card as much as possible for transactions because typically you're limited to a $50 liability for unauthorized purchases. And you don't want to use those offbeat ATM machines. I'm George Anderson. Talk to you next week.
You know, we're really blessed to have George and Chris and Barbie on the show. You know, they're bringing good information to you, uplifting information to you. And also you go to a website, there it is. When you go to the front page, you'll see the banner, Help for You. Click on that banner. You're going to find help in medical, counseling, food, jobs, so much more like I've been saying. Now, let's stop with the medical part. TBT, Tomorrow's Bread Today Medical Co-op. Now, what is that? Is it for real? Well, let me tell you what, it is for real. Everyone you'll hear on this show and you'll watch on the show is for real. Don Mc Cormick put together a co-op with his 3 clinics, and he's opening more clinics around the Houston area, that you can get good quality medical care for $1 a month. That is a fact. In fact, we went over to the Family Table Restaurant, sat down with a conversation with Don to find out more about it, and I think you're going to find this conversation very interesting. And right now, let's go on over to the Family Table Restaurant in Spring and talk with Don Mc Cormick. Tell me about TBT and what you're doing.
Well, TBT stands for Tomorrow's Bread Today. And I took that name out of the Lord's Prayer, give us this day our daily bread, which translates, the original in Greek meant give us the bread of tomorrow. And it was a reference to the second coming. And it wasn't about eating, it was about joy, and it was about the resurrection. So we thought it was a good name. But about 15 years ago, we formed a lay religious organization that was dedicated to doing the works of mercy. And one of the works of mercy is taking care of the sick. And my job in my life has been a medical administrator. I've been an administrator for HMOs and PPOs, but mostly in representing physician associations who provide health care for patients through their insurance programs, both Medicare and Medicaid and private insurance. And I did that profitably for the physicians and for the groups and for myself and my employees for about 20 years. But in 1995, I decided it was time to do something about those people in the population who didn't have access to health care because they didn't have insurance and they didn't have money.
In other words, over 10 years ago, you decided
15 years ago.
15 years ago.
1995 is when we started. And at first I thought what we needed to do was to take the surplus we had from our work, in this case it was the work of medical administration, and use that surplus to pay for people's health care and other things that are related to it. You know, it's sometimes you don't think about it, but health care is not just about when you get sick, getting a pill from the doctor or getting some sort of procedure done. Sometimes it's about having food and shelter and all
definitely.
kinds of things like that. So a lot of times what we did is spend our money on getting people a place to live and then getting them a job and getting them things that really do have the result of good health.
A full benevolence
end.
type of thing.
Right. Well, we did that from 1995 until about 3 years ago when we decided that we're not doing enough and we're not going far enough. In our normal work, we are the representative of about 500 physicians in the Houston area, and we're a full 501c3 nonprofit organization. And we're also connected to the other healthcare nonprofits in Houston, such as through Gateway Through Care, which is a way of getting healthcare for people who don't have anything. And so we said, we've got to figure out a way for people who don't have insurance and don't have money and perhaps don't have employment to get at least basic health care. And I can't do it through the normal commercial medical system because it's built on everybody paying or finding some, or sending them to Bentob Hospital or sending them to some public clinic, in which case it usually doesn't work. People either don't go to those clinics, or if they go, it's a long wait and it's a lot of trouble. And there are a lot of difficulties with that. So we decided, well, we would open a free clinic, and we did. And we opened a free clinic in Pearland, Texas, and operated it for about a year and a half, just to find out what could be done and what the real cost of providing primary care would be.
As an experiment of
As an
sorts.
experiment.
Yeah.
And we saw 4,000 patients, and we used one doctor and one nurse practitioner and one medical assistant. And we had, since we had no claims and we had no billing to do or anything like that, then we could run that program very inexpensively with very small staff.
And it worked.
And it worked very well. And what we did is we interviewed these patients as we gave them treatment. And what we would ask them is, you know, if you could pay for this, provide some labor for the cooperative, cut the grass, help us clean the clinic, help us get medicine, help us provide and raise money for the clinic, then we waive that guarantee.